The Henry Ford Bone Marrow Transplant Team follows the transplant consultation guidelines that have been developed jointly by the National Marrow Donor Program and the American Society for Blood and Marrow Transplantation. Leading the Henry Ford Transplant Team will be one of our highly experienced bone marrow transplant physicians who specialize in blood disorders and transplant. Your initial consultation or meeting will be with a bone marrow transplant physician to determine your need and eligibility for transplant. On the day of the consultation, it is important that you bring all your health records with you to the meeting. The transplant physician will then review your health records and any test results. Knowing your health history assists the physician in making a more informed decision about whether a transplant is a good choice for you. When determining whether you should undergo a transplant, the physician will consider your age, general physical condition, diagnosis or cause of your illness, how your body reacted to treatments you had before, and availability of a donor if one is needed. During this consultation, the physician will usually decide whether transplantation is your best treatment choice. If he or she decides to move forward, an overview of the transplant procedure best for you will be provided. If transplant is not the best choice for you, there are other treatments available that will be explained to you. If you become a candidate for transplant, you may need to return to your physician for additional chemotherapy prior to transplant. You may also be required to have additional tests, depending on your diagnosis and health history. A successful bone marrow transplant, or BMT, requires team effort. Since you and your family and/or caregivers are a very important part of the team, it is important that all of you take an active role in your treatment. If at any time you have questions or concerns, please tell us. Your bone marrow transplant team members include BMT physician, transplant nurse coordinator, nurse practitioner or physician assistant, social worker, pharmacist, nurses, and other medical professionals as needed. To help guide you and your family throughout the transplant process is your transplant coordinators. They will be your primary transplant contact and advocate. Your coordinator will be there to answer questions and get information for you. They will also schedule all testing as needed. Because the transplant process can be long and difficult, a transplant social worker will meet with you to review your support system, ability to follow a demanding treatment plan, and ability to pay any healthcare costs. They will also be available to discuss any feelings or social concerns you may have. A transplant psychologist will also be asked to evaluate your ability to handle the stress of transplantation. A nurse practitioner or physician assistant will work closely with your physician to watch your progress during your stay in the hospital and will follow up with you after you leave the hospital. You may need to take several medications before and after the transplantation. A pharmacist, along with other members of your transplant team, will help you understand each medication, including why it is needed, how much is to be taken, and any side effects. To help you maintain a healthy diet for optimal health during your hospitalization, you will meet with a dietitian who can assist you in developing healthy meal plans. Additional team members, such as nurses, will provide medical care and support at different times during your transplant. In certain instances, bone marrow transplant or medications associated with your transplant may not be covered under your insurance plan. We will need to contact your insurance company to get an approval for transplant. If you are being considered for a matched unrelated donor transplant, and your insurance company may not pay for the formal search and donor costs, you will be asked to provide the hospital with a predetermined amount of money, or, if needed, to fill out a grant application before proceeding. The BMT social worker and coordinators are available to meet with you if there are any concerns or questions regarding payment for your transplant. It is important for you to understand that you may not be able to have a transplant if you are not able to provide the amount of money necessary to support the added costs of transplantation. Before, during, and after the bone marrow transplant process, your transplant team will be sharing with you information that includes words you may not have heard before. If you do not understand any of the information that is given to you, please tell us as soon as possible. It is important that you and your caregivers understand everything we discuss with you.